Pregnant with a cough or cold and unsure what you can take and what you should not be taking? Hi, I'm Fray and I'm a semi-retired senior midwife. Welcome along. So today I'm going to tell you about the things that you can take, the things that you really should not be taking, some of my favourite things to take, and when you should be seeing a doctor. All right, let's rock on. I'm going to refer to my notes, because there's lots of them. Okay, firstly, for coughs and colds relief, general cough suppressants of warm water with honey and lemon juice is great. It's a natural, nature's best expectorant. That means that it loosens up mucus. There's also natural cough syrups, such as Wellida's organic cough syrup or Naturo Farms cough med relief, and some herbal syrups that naturopaths will tell you are completely safe as well. When it comes to your coughs, for dry coughs, loud rattling coughs, croup coughs, thick lung mucus coughs, etc., there's all different coughs. And one of the things that you want to have in pregnancy that you will use for years on your children as they go through babyhood, infanthood, and into childhood is some kind of guide to homeopathic remedies. Homeopathy is absolutely awesome to be using on babies. It's so safe and so effective. And so you can be looking those up and getting the right remedy, the right vibrational tincture to be using for yourself as well. Okay, for stuffy blocked noses, you can use inhalants such as eucalyptus, lavender, Fray's balsam, Carvol, Karvol capsules. You've got chest rubs such as Wellida, Ethics, Tixilix, Vicks Vaporub. Eating spicy food, Naturo Farms Sinumed relief, and again homeopathy tinctures. For a runny nose, good old saline nasal spray is the way to go. Salty water. Nothing wrong with that going up your nose. Okay, because that just gets rid of those secretions. With regards to fever, now fever in pregnancy is treated very, very, very differently from fever when you're not pregnant. If you are under 20 weeks, fever can cause a miscarriage. If you are over 20 weeks, fever can potentially cause a preterm labour of a premature baby. So we treat it really seriously. If you're starting to have some fever through your cough or your cold, then definitely be taking some paracetamol or Tylenol, same thing. And after taking that, if you still have a temperature, then you need to be seeing a doctor. Okay. Now, other things that you can take for general cold remedies is you want to drink lots of fluids, including water, herbal teas such as chamomile, vegetable juices, fruit juices such as orange, tomato, grapefruit, pineapple, apples, watercress, carrot, beetroot, and silver beet. Drink enough water a day for you to be producing about 1.5 litres a day of urine. And remember that it should come out pretty clear. If it's yellow, strongly yellow, it means you're not brilliantly hydrated. You want to eat lots of vegetable soups containing things like green capsicum, broccoli, Brussels sprouts, and tomatoes. Lots of healing herbs and spices such as parsley, basil, cinnamon, ginger, and lots of garlic and onions and stewed fruits. You definitely want to avoid sugar, particularly refined carbs. Bananas, dairy, egg whites, also and excessive wheat products also aren't very helpful when you've got a cough and a cold sometimes. Vitamin C, not in super high doses, and just your multi-mineral formulas that contain good levels of zinc, copper, and magnesium. And lifestyle-wise, you absolutely must rest and really no exercise, just rest in bed on the couch for 1 to 3 days at least, until you actually feel fine again. Actually, women can say, I feel fine when they're not. Until you feel really good again, okay? Rest till you feel really good. Now, with regards to cough syrups, over-the-counter ones, avoid those. They often are sort of what I call shotgun approaches of multiple pharmaceutical medications within them. That's a combination of expectorants, mucolytics, antitussives, antihistamines, decongestants, etc. And you don't want to be taking things internally for something that's happening externally. Cough, blocked nose, right? Don't be taking systemic medication, you need local medication, okay? So things like sore throat, take honey and lemon lozenges. Blocked nose, saline spray. Okay, so basically any prescription only. Also pharmaceutical drugs that are commonly used for treating cold symptoms of a stuffy nose, fever, or non-productive cough. You won't want to be taking any of those. No big oral treatments of pills and syrups for nasal decongestion. Use a spray. You don't want to be using antihistamines for colds because they only block symptoms and don't actually help to cure you. You don't really want to be taking any antibiotics for a sore throat unless the sore throat is strongly suspected or has been confirmed by a culture and sensitivity test to be strep throat. Any cough suppressants for a productive cough, you never want to suppress a productive cough. You want to cough up that phlegm. Okay, so my general favorites, essential oils, things like melissa, melaleuca, black pepper, they can be great, as sort of a chest rub, etc. And homeopathy, okay, I'm going to give you some specifics here. And I know some of the words are weird, but you can Google them. Okay, so general remedies, you can do a blend of antitat, aconite, gelsemium, hippocalf, and hypericum. Take 2 drops under the tongue 3 to 4 days. 3 to 4 times a day, or you can add 4 to 6 drops to, say, 300 mils of warm water, shake it, sip it throughout the day. And for a chesty cough, Antart. For sore throat, nerve pain, discomfort, hypericum. For irritable coughing episodes, hippocalf. And for weakness or fever sort of feeling, gelsemium. And influenza is really, really, really different from colds. Okay. There's a saying, like, if, when somebody has a cold, they think they've got the flu, and when they've got the flu, they think they're dying. I mean, influenza is super, super serious and can have catastrophic outcomes in a pregnancy. So you must always be seeking medical care, probably hospitalized care, if you actually have full-blown influenza. If you've got a common cold, these are the times when you want to see a doctor. If you've got high fever above, say, 37.5 after taking paracetamol or Tylenol, if you've got common cold symptoms that just don't seem to improve after 3 to 5 days, or the symptoms are worsening. If you've got coughs that bring up greenish, yellowish, or foul-smelling phlegm, a cough that's accompanied by a high fever, coughing or breathing that is causing sharp chest pain, shortness of breath, coughing up blood, any of those are symptoms of potentially a secondary bacterial infection, such as bronchitis or even pneumonia, and they do require antibiotics. Or if you've got sore throats with yellow-white spots filled with pus, or throat or on your throat or your tonsils, those yellow-white spots, especially if it's combined with high fever, swollen or tender glands, bumps in the front of your neck, a rash during or after that sore throat, and very much if there's any patient history of rheumatic fever or exposure to rheumatic fever. So yeah, hopefully that's really helpful. And I just wish you all a wonderful rest of your day, and don't hesitate to go on to motherwise.app, and join my Motherwise tribe, where you can get way more prenatal education. Okay, bye everybody.